Good afternoon, everyone. I'd like to welcome you to the annual benefits meeting of the Penn State University Retirees Association. I am Clif Merchant. I am the president-elect of the association. Our president, Chris Hurley, sends his regrets that he is unable to join us today. Our program today is going to be presented by Kelly Bartley-Weber, who is with the Penn State Human Resources Office, and Tyler Quinn, who is with Highmark Freedom Blue. Kelly Weber is an employee benefits specialist and has been with the Penn State Employees Benefits team since April 2015. Kelly primarily works with Penn State retirees population. Penn State is home to many of Kelly's family and members, and she feels a deep sense of pride being able to work with Penn State employees. Tyler Quinn is a clinic manager at Highmark. He has been with Highmark for 10 years, working exclusively in the Medicare space. Tyler has been working on Penn State University's account since 2018. He and his family reside in the Pittsburgh area. We are welcoming questions. You can put your questions in the Q&A box at the bottom of the screen. Kelly and Tyler will address these at the end of their presentations. With that, Kelly, I will turn the program over to you.
Thank you so much, Cliff. So good afternoon, everyone. My name is Kelly, and we are going to talk about the non-Medicare eligible retiree benefits for 2023. I'm sure many of you have heard that our active population, so our active employees, are moving to Highmark as well. And we are going to continue that kind of into the non-65 retiree population as well. Estefania and I have been kind of traveling the state of Pennsylvania, doing some open enrollment meetings together, and I have asked her to join us here today. Steph, do you want to say a quick hi?
Yes, of course. Hello, everyone, and thank you so much for having us. Yes, Kelly mentioned we've been doing a little Penn State tour since the middle of September, and we finished all our in-person meetings. We stopped at many campuses around Pennsylvania. And it really has been a lot of fun. So thank you, everyone, for the, everyone in the Penn State world. It's really welcoming. So appreciate everyone being so great. And hopefully you can learn a little thing or two today. And of course, the session's for you. So ask away and we'll make sure to answer all your questions.
All right, Steph, thank you so much.
Thank
so
you.
Without further ado, we're going to go ahead and get started. Gonna find my navigation tools. So as I mentioned, our Penn State non-65 retirees are going to be moving to Highmark as well for the upcoming calendar year of 2023. I kind of want to help ease this transition by letting folks know that there are going to be no plan design changes. So we're going to have the same health plan deductibles. We're going to have the same co-insurance amounts, same co-payment levels. They are all going to remain the same for 2023. Additionally, we're going to have the same co-insurance and out-of-pocket maximums for our prescriptions. And I think one of the nice features is we are going to get one ID card. So currently, if you're non-65, you have an Aetna ID card for your medical services and a CVS Caremark ID card for your prescription services. And so by making this transition back to Highmark, we are going to go to one ID card, which should be delivered by mid-December and eligible for use on 1/1/2023. In keeping with kind of what we're going to continue to have access to, I want to share that just as we have a national network of providers under the Aetna plan, we are going to continue to have that with the Highmark plan as well. So you will be able to see in-network participating providers. We do have out-of-network benefits as well, but you always seem to get a little bit more bang for your benefit, we say, by seeing an in-network provider. We're going to continue to have preventive services covered at 100%. So I'm going to modify this part of my speech. Usually I start with, the 2-month well baby visits, the 6-month well baby visits. But since, we are all part of that, and I'm including myself, obviously, we are all part of that aging population. This is going to include things like colonoscopies that start on an annual basis at age 45. Shingle vaccinations, I believe Steph might be able to pop in here, but they begin at age 50. So, these are all going to be covered at 100% with your in-network providers. And we want to encourage you to make sure you are getting those preventive services. Additionally, regardless of where you reside in the country, you will have emergency care that is going to be treated at an let me try that sentence again, at an in-network level. So if you are traveling out in the Grand Canyon, you're riding the donkey down, you're doing the tour, you get bucked off your donkey, then bitten by a rattlesnake, you don't have to worry about having someone have a smartphone in the car looking for the closest participating emergency room. You want to go and receive the care that you need at the closest medical facility. And regardless of where you are, that's going to be treated like an in-network claim. So moving on, I want to, we've talked about not changing the plan design. So that's a great thing. However, I am going to share, we are changing the plan names. Now, when we moved to Aetna 5 years ago, we renamed the plans, the PPO plan and the PPO savings plan. We had received a lot of feedback from employees and retirees indicating that those plan names, they just weren't different enough. And a lot of people found them confusing. And so with that being said, our PPO plan is now going to be the Retiree Lion Traditional Plan. So this is the plan that has a $375 individual deductible and a $750 family deductible. Now remember, on this plan, that deductible applies to your high ticket items, your lab test, x-rays, your in and outpatient services. And that deductible is the same whether you are retired tech service or retired faculty and staff. This plan also has designated copays. So you have a $20 office visit copay with your primary care physician. You have a $30 specialist visit copay. And then you pay a percentage of your prescriptions. So on the Lion Traditional Plan, you pay 50% for generics, 50% for non-preferred, and 70%. Let me say that one more time. 50% for generics, 50% for formulary, and 70% for non-formulary. And you're going to pay those co-insurance amounts until you hit $2,000 per person. And so again, I just want to kind of point out that the deductible on this plan does not include office visits or your prescriptions. You're looking at kind of 3 separate areas of funding on this plan. So your deductible expenses, then your copays, and then your prescription out-of-pocket maximum. Now, the PPO savings plan is now going to be known as our Lion Advantage plan. So this is the plan that has the $1,600 individual deductible and $3,200 family deductible. Once you meet your deductible, you will move into the co-insurance portion of the plan, where you pay 10% of those allowed amounts. With the Lion Advantage plan, if you are currently enrolled in this plan, and you have a health savings account established, like maybe you still have it from when you were an active employee, you have the ability to make contributions directly with Health Equity up until the time you enroll in Medicare. I do want to share, though, that there's no annual employer seed funding on the Lion Advantage plan once you become a retiree. And, just a little bit more instruction on how this plan works. All of your services, whether it's medical or prescription, in and outpatient services, all of these services get applied to your deductible. Once you meet that deductible, you move into that co-insurance portion of your plan where you pay that 10%. So a lot of these details were sent out in our annual retiree mailing that we sent towards the end of October. We are going to continue on with what we call the value-based benefit. So it was formerly the value-based benefit, but moving forward, we are going to call this the condition care program. And this is only if one is enrolled in the Lion Traditional Plan. If you're enrolled in the Lion Traditional Plan, you used to have access to the value-based benefit, where if you were diagnosed with diabetes, high blood pressure, or high cholesterol, you could voluntarily enroll in this program. Well, going forward, it's kind of a new age of the value-based benefit. It's, Penn State wants you to go and manage the conditions that you have, whether it's diabetes, high blood pressure, or high cholesterol. And this program is designed to eliminate some cost barriers. So when you go in to your doctor's office to have a follow-up visit for one of these three conditions, or you have lab work that is related to one of these three conditions, these claims will automatically be paid at 100%. So there is no enrollment in this plan. This is now what we consider a claims-based program, and these claims are automatically just going to be processed at a higher level. Now, please keep in mind that this does not include prescriptions. So the best example I like to give here is, if you're a diabetic, your diabetic supplies are going to be covered, the insulin test pump, the test strips, but the insulin is an actual prescription and that would not be covered at 100%. So kind of just want to make that differentiation. As we're going through this transition, beginning 1/1, you can continue to pick up your prescriptions, whether you're using a retail pharmacy or University Health Services pharmacy. You just need to present your new ID card as of 1/1. If you are currently doing a mail order prescription, let's say you have a mail order prescription for maintenance or for a condition, you're taking it every month. Mail order allows you to get a 3-month supply at a time. If you have open prescriptions, so you have 6 months left of your annual prescription that your doctor gives you, this is automatically going to transfer over from CVS Caremark mail order to Express Scripts. If you are taking a specialty medication and you're using the CVS specialty pharmacy, that is automatically going to be transferred over to Highmark's Accredo, which is their specialty medication, their specialty pharmacy. There could be some differences between the Highmark and the CVS Caremark formulary listings. If that is the case, you can expect a letter. You will be receiving a letter letting you know that something maybe has gone from formulary to non-formulary. And if you are taking a prescription that does require a prior authorization with Highmark, you will be receiving a letter on that as well. I just want to point out, we have, again, included this in the letters for the past couple of years. This is no different than it has been, but your lab tests, your blood work, these all go towards a deductible, whether you are on the Lion Advantage plan or the Lion Traditional plan. And, when you are paying a deductible, that's the amount of money that you, the member, are responsible for before the plan kicks in. And so when we see a standalone facility, they have the ability to charge a lower amount than a hospital facility. A hospital has a 24-hour emergency room. They have the staff, they have the lighting, they have the equipment expenses. But when you see a standalone facility that's open from 9 to 5, they don't have to, charge a certain amount in order to keep their doors open. And so if you're in the deductible part of your plan, so the part where you're paying that contracted rate, you're going to see a lower amount when you use Quest or LabCorp services. If you have met your deductible, you will see the lowest amount of coinsurance. So you'll pay 10% with Quest and LabCorp. You would pay 30% with another in-network hospital-based lab, and 50% if you are seeing an out-of-network provider. Annual open enrollment plan change. So annual annual retiree plan change option. So I want to review this quickly. This is for our non-Medicare eligible retirees. We sent out, again, a notice towards the end of October, and included in that letter was a plan change form. So non-Medicare eligible retirees do have the option of going from the Lion Traditional to the Lion Advantage plan, or vice versa. So you can do that every January 1st. I do want to point out that if you are newly moving to the Lion Advantage and you have never had this plan before, you are not automatically set up with a health savings account with Health Equity. However, because you're enrolled in a qualified high deductible health plan, you could establish your own health savings account, whether you log on to Health Equity and do open individual account, or you go to a local bank that has a license to do health savings accounts. You can open that on your own behalf. But again, you do not get that seed funding once you're a retiree. So included in this letter was a plan change form. And if you wish to make a change from the traditional to the Advantage or vice versa, you do have until November 22nd to return that plan change form to the employee benefits team. And with that, I would like to go ahead and turn it over to Steph so she can talk about some of the added benefits that come along with being a Highmark member.
Thanks, Kelly. So hello, everyone again. My name is Estefania, and I am a Highmark Blue Shield representative. I'm very happy to be here with you. And, my portion of the presentation, I'm just going to go over some value added benefits that, most of these are free for all members. And this is one of them, blue365deals.com. So if you go to that website on the screen, blue365deals.com, and there is a phone number available on the screen. But if we can go to the next slide, if you go to that website, you're going to be able to find a lot of different discounts, wellness discounts for products, services. Here are a few of the most popular discounts. Some of the brands: Reebok, Skechers, Garmin, Fitbits, Jenny Craig, Gym Pass, a lot of True Hearing discounts, as well as we have 2 LASIK eye surgery discounts, LASIK through LASIK Plus and Qualsci LASIK, which there are large national vendors, and then we have some Fitness Your Way, some gym membership discounts. You can go to that website, blue365deals.com, and check out all the different discounts. In order to redeem them, you do have to enter your Highmark member ID number. And then once you, register and log in, it'll tell you how to redeem those discounts. So definitely check it out, and we can move on to the next slide. Thanks.
Okay, so I thought there was a couple of extra ones. I apologize, Steph. I'm pretty sure I pulled up the right slide. But I'm going to move on. I'm going to talk about the lifetime benefit solutions. So they will continue to be our retiree billing vendor. You do get billed on a quarterly basis. So your payments for your retiree medical are due January 1st, April 1st, July 1st, and October 1st, which is the first of the billing, the first of every quarter. There's a 60-day grace period, and you can make your payments by, paying by check each quarter, or you can prepay by check for, a desired length of time. You can establish an automatic withdrawal. So this is something that would occur monthly. When you do set up automatic withdrawal, there are no quarterly invoices that are sent. Pay by credit card. There is a $20 fee that applies to that. So that is not necessarily, the most recommended way of making payments for your retiree benefits. But if you are in a pinch, there is the ability to do that. The member portal does also allow you to check your account status and view your payment history and print any of the correspondences that had previously been mailed out. I want to go ahead and share the rates for the upcoming calendar year. So if you are in Freedom Blue, those rates are, $80 a month per enrolled. And then for the Lion traditional plan, those rates are listed on a 4-tiered basis. So individual is just you, the retiree, or there is a 2-person rate for you and a spouse. There's a parent and child rate, or the full-fledged family, which is you, a spouse, and children. So there are the rates for the upcoming calendar year, whether you are in the Lion traditional plan or the Lion Advantage plan. And again, these are the 2 plans that are being offered to non-Medicare eligible retirees. If you are becoming Medicare eligible in the upcoming year, we send out a letter 2 to 3 months before you turn 65 or before your spouse is turning 65. And, we kind of give you some instruction. We're like, hey, we see that you're turning 65. You're going to want to visit your local Social Security office. You do not want to enroll in a separate Part D plan if it is your intention to stay with the prescription drug plan. And after you receive your Medicare card, you're going to want to complete this Freedom Blue application, and we include that in our mailing, and return that to the employee benefits team with a copy of your Medicare card, and you want to do that prior to turning 65. Now, one of the questions we get quite a bit is, well, what happens to my non-65 spouse if I turn 65? So we have what is known as a split plan. So let's just say you are the retiree, you're the one that turned 65, your spouse is under 65. What happens is you move over to that Freedom Blue plan. And I can see I did a typo on this, boy. And it says spouse becomes primary subscriber under Aetna plan. My apologies. That should say under the new Highmark non-65 plan. So your spouse then becomes primary on that non-65 plan, and your children will be listed as dependents under your spouse. Now, if you are 65 or older and you don't have a spouse on the plan, but you have children, in this situation, this is where you, the spouse, moves over, or you, the retiree, move to Freedom Blue, and your oldest child becomes that primary subscriber on the non-65 Highmark plan. Any younger children are going to be listed as dependents under your oldest child. And in that last scenario, maybe you're the youngin' and you married someone a little bit wiser and older. And so in this scenario, you remain under 65, but your spouse ages into Medicare. Your spouse moves over to Freedom Blue, and you, the retiree, remain that primary subscriber with the Highmark non-65 plan. It's really important to note that then when you call those numbers, you need to give the Highmark reps that you're calling your spouse's social security number, your spouse's date of birth, because that's how they're going to pull them up in the system. They're being listed as that primary subscriber, and they're no longer tied to you, the retiree. There are a couple of questions that came in. I already saw some of them coming in. Currently Penn State does not offer dental and vision to retirees. So if you are retired and you have exhausted your 18 months COBRA after your retirement, there is an outside organization called PARS. It's the Pennsylvania Association of Retired State Employees. I think I've mentioned this in previous years. So if you've been here with me before, I have a lot of family members that are Penn State retirees, and I'm sure you know who their first phone call is when they get benefit information in the mail. But I have looked at this PARS information before, and for a $20 annual membership fee, you are able to select between 2 different dental plans, 2 different vision plans. You have the option of a hearing discount plan, also long-term care. So PARS is a really complete program, and you can find more information on PARS going to parsofpa.org or by calling the 800 number on the screen. If you still have an actively employed spouse here at Penn State, they can cover you and maybe your children on their active employee dental and vision plan. Your spouse just needs to log into Workday and make sure that they're adding you to those coverages. Or as a retiree, you have the iMed retiree discount plan. This information was provided in that mailing as well. So you have, that printout ID card. This is not an insurance program. You can't call iMed and say, hey, here's my social security number. Can you look me up? This is a discount program. So by providing your iMed, your in-network iMed provider, this discount card, you have the ability to receive discounts on services and products. And so that is available for retirees as well. And our last screen here. So this is going to be slightly confusing, and I really want to just make sure that people are fully aware. But when we talk about a Highmark Well 360 Concierge, this is for our non-65 retiree population. And so that 844 number, 945-5509, that number is available today, that concierge team, for retirees to call and ask questions about anything that we've talked about today. Some of the Highmark perks, those 365 Blue deals, questions about details on plan design, or if my doctor is in network. Health equity, that is that health savings account. So if you currently have a health savings account with health equity, you can give them a call to ask questions. Lifetime Benefit Solutions is that retiree billing number. So you can give them a call for any billing questions. And then we also have the Highmark Freedom Blue retiree number. And I do want to point out that we have a current members number. So those of you who are already enrolled in Freedom Blue, this is a contact number for you. But if you are one of those folks that are getting ready to age in this upcoming year and you have questions, maybe you're in the middle of some type of procedure, you're going to have a knee surgery this year, and you want to know what that's going to look like once you move to Freedom Blue, you can call that non-member Freedom Blue number. Additionally, I always recommend for folks to bookmark our retiree website. We have, over the past year, Alan Cameron reached out to me. He says, Kelly, he says, we've all got this email from this, and I forget the woman's name, but we determined very quickly it was a phishing scam. And so, we posted information on the retiree webpage right away. Don't provide any information to this. This is not something that is a legitimate request from Penn State. So we really do try to keep that website up to date to provide, not only your resource charts, your retiree rates, your benefit summaries, but some information that might be pertinent at the time. And as always, you can call our HR services team. If they are not able to answer your question, they may direct you to Highmark, or they're going to kind of document that call, and they're going to pass it along over to the Penn State Employee Benefits team to handle. And so with that, and look at that, I didn't even turn my video on as I did the last of those slides. I apologize. With that, I do want to kind of conclude the non-65 portion. I'm going to take some questions here, and we'll see if we can't direct some of these questions to the appropriate places. So I still have a few minutes here. Okay, Steph, this one's going to be for you. We did not include these slides, and I think I might have accidentally had cut them out, but telehealth, remote access. For the past couple of years, I've been able to see a primary care physician and a specialist by telehealth. Can you talk a little bit about the Highmark telehealth option?
Yes. So maybe I can send the link in the chat. But yeah, we have Well 360 Virtual Health powered by Amwell. And so I know, that'll begin 1/1. And when you get your ID card, you can go into the website or the app and then register, and it'll be available to you 24/7. Of course, you can, once you register, you can just log in and you can use it anywhere in the country as well. And you're going to be able to connect with board certified doctors, and even, there's even pediatricians available. There's doctors that speak multiple languages. So there's a lot available, including even mental health services, behavioral health services. So, depending on the plan you're enrolled in, there'll be a different fee. If you are in the line traditional plan, then it'll be a copay. If you are in the Line Advantage plan, it'll be the negotiated rate of $64. If you're in the deductible phase, if you're not in the deductible phase, it'll be $6.40, because at that point you're paying 10%. So it is a great service. So you will definitely have that available starting 1/1 with Well 360 Virtual Health powered by Amwell. And like I said, there is a website and an app as well.
All right, Steph, thank you so much. I had a couple of questions coming in about the condition care program. What treatments for these conditions would be covered? And so again, when you are going in to see a physician and it is related to high blood pressure, high cholesterol, or diabetes. So you're going in for, maybe you go into the doctor every 3 months to kind of just follow up on that. You're not going to pay a copay. Your primary care physician copay. If you're seeing a cardiologist due to maybe high blood pressure, you're not going to have a specialist copay. And if they need to do lab work, those would be covered cost as well. But the prescriptions are the items that are not covered under the condition care program. It's just some of those services. And we actually are going to have, we currently on our website for Aetna have all of the items that are covered under the value-based benefit, which is the same program that we are migrating to a claims-based program under Highmark, and we're going to have those services listed out on our HR website as well. It says under the PARS slide, are PSU retirees now considered state employees? So PARS is going to be eligible for Penn State retirees, whether you are enrolled in the SERS retirement program or the TIAA retirement program. Steph, does the 365 deals discount program apply? Oh, this one actually might be for Tyler. Apply to the Highmark Freedom Blue retirees. So I'm gonna maybe hold that question until we get Tyler on. After I turn 65, I can move to the Lion Traditional, but still keep my health equity account. That is correct. Or because I have the health equity savings, do I need to stay in that plan until the account is zero? The IRS regulation says that you cannot make pre-tax contributions to a health savings account and be enrolled in Medicare. So that's currently the IRS regulation. But as you turn 65, you are going to maintain your health savings account. And you can use that health savings account on items like Medicare premiums, long-term care premiums. The only difference is you can continue to use them on eligible medical expenses. You can just no longer make contributions to a health savings account once you enroll in Medicare. Okay, I'm going to try to answer some of these questions. Steph, can you see the Q&A as well?
Yeah, yep, I can see it.
So I might send you a couple little messages to say, hey, can you grab this question? But in an effort of time, I want to make sure we are being very conservative. I want to make sure we are allowing Tyler enough time to speak as well. We will come back and we're going to answer some additional questions. But Tyler, how are you doing out there? Are you ready? I can stop sharing my screen so that you can share yours.
Sure. Let me see if I can figure this out. How am I doing? Does that look correct?
I can absolutely see your screen.
Okay. Getting blocked by another screen here, so apologies. Oh. Okay, sorry about that. Hello, everyone. Thank you so much for joining. As Kelly was saying, my name is Tyler Quinn, and I'm the client manager for the university's Freedom Blue PPO Medicare Advantage plan. So this is going to be for the Medicare eligible retirees. Today, we're going to cover a good bit of information, and we're going to talk about the Highmark difference. We're going to review some Medicare basics and coverage lingo. We're going to review network sharing to show you where and how you're covered. We're going to review the medical benefits of the plan, explain how your pharmacy benefits work, and we're going to talk about some Highmark support resources. So Highmark has more than 80 years of experience providing coverage. We are, of course, part of the Blue Cross and Blue Shield network, and we have received national recognition for delivering high-quality care. One of those measures is the Medicare Stars rating. The Medicare Stars rating, every company receives between 1 and 5 stars to show how well their plan performs. Stars are determined by several factors, including helping members stay healthy, managing chronic conditions, ensuring positive member experiences, and providing effective customer service. So Freedom Blue PPO, the plan we're going to talk about today, is a 5-star plan. That way it's not just me saying it. Medicare agrees with us, and it's a wonderful plan. We're very proud of that rating. Okay, so just to set some, set the basics here, how Medicare works. Original Medicare is made up of 2 parts, Part A and Part B. Part A is your hospital coverage, so inpatient hospital care and skilled nursing facility care. Part A does not typically carry a premium. Part B, that's your doctor's office coverage, so your doctor's visits, your preventative care, and testing in lab. Part B is the part of original Medicare that would cover a monthly premium. In 2023, the Part B monthly premium is about $164 or $165, which is actually a $5 decrease from where it was or where it currently is this year. Part C is what we're going to be talking about mostly today. That's your Medicare Advantage plans. So that's original Medicare benefits plus extras. So it's going to cover everything that's covered by Part A and B, but you can also have benefits like your prescription drugs bundled in as well. And speaking of prescription drugs, Part D is your prescription drug coverage. You'll notice that Part D is not part of original Medicare. So original Medicare does not cover your prescriptions at the pharmacy. And if you if an individual with Medicare who is Medicare eligible would like Part D, they would have to, obtain that coverage through an insurance company. But as we're going to talk about today, your prescription drug benefits are rolled into the Freedom Blue PPO plan. Okay, so enrolling in coverage or changing your plan, there's two main enrollment periods that I'd like to talk about. The first Kelly kind of touched on before is your initial enrollment period. Your initial enrollment period is 3 months before, the month of, and 3 months after the month that you become Medicare eligible. So for most individuals, this is going to happen at the age of 65. As Kelly said, you don't necessarily have to wait until the month that you turn 65 to take action with Medicare and Social Security and getting these things lined up, or with the university for that matter. You do have, a 3-month window before the month that you turn 65 to kind of get the ball rolling on these things. And Kelly and I would both recommend that you try to do that if possible. The other enrollment period is the annual open enrollment period. Now, this is going to, fluctuate. Obviously, the university sets its own open enrollment period, but Medicare in general has an open enrollment period that happens every year from October 15th to December 7th. The reason I wanted to talk about this enrollment period today is because this is the time of year where you're going to be inundated with mailings from different carriers, hospital systems, advertising all the different types of Medicare plans that are out there. I know I even get some of these mailings. I am not Medicare eligible just yet. So you really want to be wary of what you're receiving, what the implications are that kind of come along with some of those offerings, because a lot of them can be a little confusing. Sometimes they're presented as, maybe a discount program for prescription drugs and things of that nature. So what ends up happening, though, if you do take action on maybe a different type of plan is you may end up kicking yourself out of the Penn State plan if you take action on enrolling in another Medicare Advantage product. So Kelly and I, we work year-round to try to remedy these issues as they come through. But I just kind of wanted to let everyone know that you really want to be wary of what you're receiving, what you're signing up for. If they're asking you to take action on an application or something of that nature, you do want to be careful, because that may end up terminating you from the Penn State plan. Okay, so healthcare coverage lingo. I do know that some individuals on the call today, this might be very basic information. I hear people kind of use these terms interchangeably, so I just wanted to make sure to kind of set the the terms here so that we understand what we're referring to when I go into the benefits in more detail. A deductible is a specified amount of money the insured must pay before the insurance company will pay on a claim. A copay, however, and I've heard these terms used interchangeably sometimes, a copay is different. That's the set amount that you would pay for a covered service. So a doctor's office visit may carry a $10 copay. A specialist office visit may carry a $20 copay. A coinsurance, however, as opposed to a fixed dollar amount, is a percentage that you would pay for covered service. So for example, if your plan pays 80%, you may be responsible for the other 20%. These are not specific to the Penn State plan, just merely examples. We're going to go into the benefits in more detail. The maximum out of pocket. Maximum out of pocket is an important number, an important figure that you should, definitely be familiar with. The Penn State plan has very, very reasonable out of pocket amounts, in my opinion. So we'll talk about those in more detail here. But the maximum out of pocket is the most a member would pay for covered medical care per calendar year. So once you reach your out of pocket amount, the plan would then pay at 100% thereafter. Okay. So we provide the basics you can count on. Just a few of the perks of the plan here. Obviously, we have the huge network. We are local here in Pennsylvania. You have access to the community hospitals across the state, but also nationally. You do have the flexibility, however, to go out of network. You do have out of network benefits. The only caveat with out of network benefits on the Freedom Blue plan is that you do need to see a provider that accepts Medicare. There's no cost to preventative care. So things like your annual wellness visit, your cancer screenings, those are not subject to any cost sharing. Virtual health. So obviously, as we're finding here today, the world is changing over the last few years. More things are happening virtually than in person anymore. There are alternatives to visiting the doctor in person. When appropriate, you would be able to see your doctor virtually as opposed to going and seeing them in person. Hearing benefits, we're going to talk about these in more detail as well, but we do offer low copays for high quality hearing aids with True Hearing. Fitness benefits, so Silver Sneakers, for those of you who might be familiar, is a no-cost in-person and virtual exercise and wellness membership. And I have a slide dedicated to that as well with some more information on that. You do have benefits. Yeah.
I was going to say, you mentioned something about hearing, and there was a hearing question that came in. So I wanted to see if we could maybe address that now.
Sure.
All right. It says, I see there's a $20 copay for hearing exam. It says on page 26, so I'm not 100% sure which document they're referring to, but on page 27 of the booklet, it says routine hearing exams are covered. Is there a difference between hearing exams and routine hearing exams?
So your routine hearing exam, I do have the benefits that we're going to go over individually. It is subject to a $20 copay. But yes, I mean, there is a difference between a diagnostic and a routine hearing exam. Both are going to fall under your specialist copay, however. I hope that answers the question. If it doesn't, feel free to type additionally. I hope that answers your question, though. You would be subject to your specialist copay as part of your routine hearing exam, though. Transportation benefits, so rides for non-emergency or routine care, you do have benefits. Maybe you're trying to go to a doctor's visit and you don't have a ride or transportation. There are routine transportation benefits built into the plan as well. And then, of course, your emergency benefits, national and worldwide emergency care. Few more things here, a few more perks. Your annual wellness visit is a yearly conversation with your doctor to review your well-being. The Highmark House Call program, that's a personalized health and medication review where someone would physically come to your home and have a conversation with you and kind of talk through how things are going for you and things of that nature. The clinical care team, so experts to help you manage your health. Maybe you have a chronic condition or a ongoing condition that you're looking for some additional help with. The clinical care team is there to assist you if you'd like. Nurses on call, exactly as it sounds, we have a staff of nurses who are available 24/7. So maybe you're not able to get through to your doctor's office, or you just would like to kind of have some additional insight. We do have nurses that are available to help. The PALS program is People Able to Lend Support. This is a volunteer-based program that is statewide. And essentially, this is just individuals who are kind of giving their time to help out seniors that might need help with certain things. I've heard of individuals getting rides or helping with things around the house. So that's a wonderful program, and with some really special people that are trying to help out. And then the Wellness Rewards program is earning gift cards for wellness activities. So this is taking care of preventative services that you're probably already going to do on a yearly basis. Anyways, Highmark sends gift cards out once those gaps in care are filled. Kelly, I see you popped back up again. We got another question?
I did. You were talking about the nursing on call. Is there a number on the back of the ID card? Where is the number located for that people would be able to find?
That is a great question, and I will get that for you before we adjourn today. I don't know with 100% certainty that that's listed on the card or not, but I think I'll be able to get that before we're done here today. Okay.
Perfect. Thank you.
Okay, so Silver Sneakers. I did promise a little bit more information on Silver Sneakers. This is included in your plan at no additional cost, and this is a gym membership wherein you can physically go to fitness locations. There are thousands of fitness locations with various different amenities. You don't have to enroll at just one. You can enroll in multiple locations at once, and you can participate in the classes that are designed for all levels. Something newer, again, with our rapidly changing world here, is that you are able to do things virtually. So there are on-demand fitness classes that are available through Silver Sneakers. You can also do live classes virtually in workshops. And then they also have their own app. So you can kind of manage your own workout plan via their app if that interests you as well. They also have community-based events. So group activities and classes that happen outside of the gym, as well as meals and holiday celebrations and socials and things of that nature. So we hear a lot of positive feedback about Silver Sneakers. If you're not already involved with that and it interests you at all, I would really encourage you to look into it. All you need is your Freedom Blue PPO member identification number to get started. I also have the website listed here, silversneakers.com. The start here is essentially, I believe, more catered to, maybe if you're looking to sign up or looking to get your card. Silversneakers.com, though, if you're already, involved with the program, it is a good website as well, and you can look for participating locations in your area and things of that nature. You can also give them a call. Oops, sorry, advanced the slide a little too quickly. With the 1-800 number on the screen here as well. They're available Monday to Friday, 8 a.m. to 8 p.m. Okay, so we're going to talk next about where you're covered, so how the PPO plan works. PPO stands for Preferred Provider Organization. So as we talked about before, you do have out-of-network benefits, and you may pay less. You do have out-of-network benefits, but you may pay less when you use in-network providers. If you choose to go out of the network, however, you do have to make sure that the provider you're using is Medicare participating in order for Highmark to reimburse them. You do have access to in-network providers, network participating providers in 48 states, Washington, D.C., and Puerto Rico. What we're going to find when we talk about the benefits in more detail is that member cost sharing is the same for most eligible services, whether the provider is in-network or out-of-network. So your copays, your co-insurance, if they remain the same for most benefits that we're going to talk about here in a few slides, whether they're in or out of the network. Network sharing is Blues plans across the country share their Medicare Advantage PPO provider network. So if you're traveling, you can live anywhere in the United States with this plan, but wherever you are, you will be able to receive in-network care. It just does slightly differ depending on where you're trying to receive that care. We're going to go into that in a little bit more detail on the next slide. What I do definitely want to emphasize, though, urgent and emergency care are always covered coast to coast and worldwide. As Kelly said previously, You do want to make sure you're going to the nearest facility in case of an emergency. There's no need to worry about network participation in those situations. Okay, so the Medicare Advantage PPO network access. What this slide is illustrating for us is the 48 states essentially that have a network within them, and then the 2 states that do not. I am going to out myself here. I had to look to see which state that was in the middle of the country there. I did not know off the top of my head which state that was. It's Wyoming, as I'm sure you guys all knew. Maybe that was just me that didn't know that. It's Wyoming.
I was gonna say Utah, so I'm gonna be right there with you. I was not right on top of that either.
Yeah. So what you're probably asking yourself is, what happens if I find myself in Alaska or Wyoming? As you can see that there's no participating network in those states. So another perk of the plan here with Freedom Blue PPO through the Penn State is that if you find yourself in an area where there is no participating network available, any provider who accepts Medicare is going to process their claim, will process at the in-network level with the insurance. So I'll say that one more time. If you find yourself in an area with no participating network available, Highmark is not going to punish you. You have no option. So any provider in those areas that accept Medicare will, that their claim will process at the in-network level. I also want to make sure to clarify that the states that are shaded in blue, while there is a network available, I just want to make sure it's clear that that doesn't mean every provider in those states is participating. That means, there are still going to be out-of-network providers and in-network providers. If you're looking to stay in the network, if you're traveling, if you're moving to somewhere new, or you just find yourself, maybe somewhere where you don't typically receive care, I would encourage you to utilize the customer service department or our website to make sure that you're utilizing network providers. Kelly, I saw you pop up there again. Did you have another question?
That was the question while we were talking about networks. Someone asked, how do I find a Massachusetts participating provider? And you just answered it like you knew that question came in.
Okay, yeah, we, like I said, customer service is an awesome resource. We do have a website that has, a national doctor and provider finder, and we'll make sure that we get you the answer if you have any questions. Okay. Okay, so now we're going to take a deeper dive into the benefits specific to the Penn State Freedom Blue PPO plan. Okay. All righty, so as you'll see here on my handy dandy grid, you do have in and out of network benefits. The benefits that only have one number assigned to them, though, these are passive benefits, meaning your cost sharing is going to be the same whether you're in or out of the network. Okay, so you'll see there are a select few benefits that your cost sharing may change if you go out of the network, and I'll make sure to call those out as we go. But there's no deductible associated with the plan. So there's no amount of money that you have to satisfy up front before the insurance pays. Your in-network member out-of-pocket maximum is $500. So if you stay in the network for your Medicare covered services, this does not include prescription drugs. It's going to be medical only. But if you stay in the network for your medical services, the most that you'll pay out of pocket in a calendar year is $500. You do have a combined in and out of network member out of pocket maximum for Medicare covered services as well. So if you do decide to go out of the network, even if you went out of the network for all of your care, your medical care in a calendar year, the most that you would pay is $750 in a calendar year. Okay, so that 500 does roll into the 750. It's a combined in and out of network. So they're kind of working together there. As we talked about before, your annual physical exam, your screenings, your preventative care are going to be covered in full. Your doctor's office visits, when I say doctor's office, I mean your primary care physician is going to be covered at a $10 copay. Specialist office visits are subject to a $20 copay. Your imaging services, so CT scans, MRIs, X-rays, mammograms, there's no cost sharing. They're covered in full for you, whether you're in or out of the network. Okay, diagnostic testing, like blood work is covered in full for you. Again, that's whether you're in or out of the network, it's covered in full. Outpatient surgery is covered in full. Your emergency room services are subject to a $65 copay, and your urgently needed care is subject to a $40 copay. Inpatient hospital stays are covered in full. I can't tell you how many people I talk to a year that talk about how scared they are if they ever have to go into the hospital. You know, how much is that going to cost me? So to know up front that your inpatient hospital stays are covered in full, it's a tremendous benefit, a very rich benefit. Your skilled nursing facility care. Skilled nursing facility care, just for those of you who don't know, that's usually like a step in your rehabilitation process. Maybe you've been in the hospital. You don't have to, it's not necessary that you were in the hospital, but typically you see that when someone might have been hospitalized and they're, needing a one step lower in care there for their rehabilitation, they're not quite ready to go home. So skilled nursing facility care is also covered in full. Again, that's whether or not it's an in or out of network provider. Part B drugs. Part B drugs, this is not your pharmacy. These are drugs that would be administered in a medical setting. So some examples of Part B drugs would be things like cancer drugs. Also, the contrast material that is used as part of an advanced imaging scan is also considered a Part B drug. So those types of drugs are covered in full. So we had a question on the annual routine hearing exam. It is subject to your specialist copay of $20. We do have benefits for hearing aids as well. So True Hearing is a vendor that we partner with, and they provide 2 different levels of hearing aids at fixed copays. So $499 copay per aid for the True Hearing Advanced, and a $799 copay per aid for the True Hearing Premium. If you don't wish to go with either of those hearing aids, you do have a $500 allowance for any other hearing aid through True Hearing. And if you don't wish to go with True Hearing at all, you have a $500 allowance for hearing aids every 3 years from any other provider. So you have your options there. Emergency ambulance services are covered, but they are subject to a $100 copay. Non-emergency ambulance services performed by an in-network provider are subject to a $100 copay. If you go out of the network for a non-emergency ambulance service, it's subject to a 10% coinsurance. So I just want to touch on this. I've gotten questions in the past. Non-emergency ambulance service, I would say the most common example of a non-emergency ambulance service would be maybe being transported from one medical setting to another, where you're not calling the ambulance and saying this is an emergency. It's more so just it's a non-emergent situation and you need transport to and from one location to another. So I hope that makes sense. If you are in case of an emergency, an ambulance service is always going to be that $100 copay, whether they're in or out of network. But okay. Okay, so then we have your therapies. So physical, speech, and occupational therapy are all subject to a $20 copay, and that's per visit, per day, per provider. So each time that you're going to your therapy sessions, they are subject to a $20 copay. Renal dialysis is covered in full when performed by an in-network provider. It has a 10% coinsurance if you go out of the network. So this is another example of just a few benefits here that do not have matching cost sharing in and out of the network. So to get the most bang for your benefit, I think is what Kelly said earlier, it would behoove you to stay in the network for those services. The same thing goes for oxygen and oxygen supplies. It's covered in full if you go to an in-network provider. It's subject to a 10% coinsurance if you go to an out-of-network provider. Your inpatient psychiatric hospital care, this really falls the same as a regular inpatient hospital stay. It's covered in full, 0% coinsurance per admission. Outpatient mental health is your specialist copay, $20 copay per session. Home healthcare is covered in full, whether it's performed by an in or out of network provider for Medicare covered home health services. And then durable medical equipment, so that's things like prosthetics and orthotics, are covered in full when provided by an in-network provider. There is a 10% coinsurance if you go out of the network for those supplies. Okay, so understanding the coverage stages of prescription drug coverage. We talked about the medical benefits. Now we're going to hop into the prescription drug benefits. Some individuals may not know there's actually 4 stages to prescription drug benefits. The first of which is a deductible. So again, we talked about what a deductible is. You pay a set amount before your plan starts to pay. If you do not have a deductible, though, you skip this phase and you go to stage 2. You all do not have a deductible as part of your coverage, so we skip the deductible stage and we go to the initial coverage period. In the initial coverage period, you're going to pay a set amount like a copay, and then your plan pays the rest. But what happens behind the scenes, once the total that both you and your plan has paid hits $4,660, you then actually move to the next stage, which is called the coverage gap or the donut hole. University-sponsored coverage provides enhanced coverage during this phase, so cost sharing remains the same as the initial coverage period. This is a tremendous benefit for individuals who are taking high-cost medications. So in the open market, and if you were to go and secure your own coverage independently, you very likely would not be able to find coverage that covers you into the coverage gap. So the university continues the same cost sharing from the initial coverage period into the coverage gap. Most plans out there that you would secure individually, you could be paying 25%, up to 25% of your prescription drug costs, which if you're taking high cost medications could be very, very expensive. The next and final stage of the coverage stages is the catastrophic coverage period. So once you have paid $7,400 in member cost sharing, you would then pay either 5% of the cost of the drug or $4.15 for your generics and $10.35 for brand name drugs, whichever is more. If you're in the catastrophic coverage phase, though, and you've already spent $7,400, I'm going to go ahead and guess that you're going to be paying that 5%. It's much more rare, obviously, for someone to have paid over $7,000 and reach the catastrophic phase. It is possible, obviously, and that's why it's there. But this is much more rare than reaching the coverage gap phase. Okay, so now we're just going to dive into the benefits with the plan here. As we said, this is the initial coverage period. There's no deductible, so you're skipping right over that phase. You do have a $12 copay for your generics. Both preferred and non-preferred generics are subject to a $12 copay. Now, this is for up to a 31-day supply. You can get a 90-day supply at retail. It's just going to be subject to 3 times these copays. The preferred brand drugs are subject to a $20 copay for up to a 31-day supply. Non-preferred brand drugs are a $50 copay for up to a 31-day supply. And then the Tier 5 specialties are a $50 copay for up to a 31-day supply. Mail order is up to a 90-day supply. And now these are the same copays and cost sharing that you'll find at UHS. So if you're accustomed to that, we do have those benefits as well through UHS. So for up to a 90-day supply, it's a $24 copay for your generics. And then for the preferred brand drugs, it's a $40 copay. Non-preferred brand drug is a $100 copay. And then your Tier 5 specialties can only be filled up to a 31-day limit. So it's going to be that same $50 copay. So you'll notice here, this is going to be the almost an identical slide here talking about the coverage gap because your cost sharing remains exactly the same as it was in the initial coverage period. And again, this is an enhanced benefit that's provided through the university's coverage. So not everyone has this. You may not even notice that you even go into the coverage gap as a result. So it's a wonderful benefit, and I won't bother reading you the copays all over again there. That was probably tough enough to hear me say it the first time. So same cost sharing in the coverage gap. If you were to move into the catastrophic coverage period, which again is when your drug spend reaches $7,400, we did touch on this before, you would pay the greater of 5% or $4.15 for your generics, or $10.35 for your brand or all other drugs. If you need extra help paying for your prescription drugs, these agencies may be able to help. These are probably, some of these numbers are probably just good to have if you don't already have them anyways. The number for Medicare, the number for Social Security, you know, I'm sure individuals who qualify for the VA probably know how to get in touch with the VA. Okay. And we can go back. Sorry, I don't mean to rush us through. I just know that we're short on time. So the last thing I just wanted to touch on is another additional benefit that's provided through the university's Freedom Blue PPO plan. These drugs listed here, I pulled this directly from the annual notice of change letter. These are traditionally Medicare excluded drugs, meaning they are not eligible for coverage under a normal plan. But the Penn State plan does provide additional coverage for these drugs, and they would be eligible for coverage under your plan. So I will spare you reading all the different drug names. I probably can't pronounce all of them very well, but this again is pulled, I believe it's page 60 of your annual notice of change letter. And I can make sure to try and get this to whoever may want it, but these drugs are available for coverage under your plan, and they would not be under pretty much all other Medicare sponsored plans because they are Medicare excluded drugs. Okay. And then finally, these are the same numbers that Kelly put up. This is specific, obviously, to the Freedom Blue plan. So if you are a prospective member, if you are going to be retiring in the near future and you have questions, please give us a call at this 1-800 number here. And please use the reference code 23FB for Freedom Blue, and then 178428. So if you're calling in, please make sure you have that reference code when you call in with your questions. Current members, of course, would call the number that appears on the back of their ID card. Yeah, they will be able to assist you with your questions.
Thank you, Tyler. So, Brian and Ellen, and Clif, I just want to touch base with you guys. I have some additional questions in the question and answer box. Are we good to keep going on time? I don't want to overuse anyone's time here.
All right, to go ahead with me.
Okay. So I still have staff available as well, but most of these are coming in from our over 65 population. So Tyler, do you know if at-home COVID tests are still going to be covered under the Freedom Blue plan?
They are, yes. I don't have any indication that coverage would not be offered. But since you're purchasing them and taking and getting them, using them at home, you would need to submit for reimbursement for those types of products. So you would want to keep like an itemized receipt, and you would want to send it in to us so that we can process a claim for you to reimburse.
Okay, so Tyler, does the 365 deals discount program apply to the Freedom Blue Highmark members?
It does, yeah. Blue 365 applies to all plans. So
that's exciting. I
it
did
is
not
exciting.
know that.
Yes.
So Steph, thank you for bringing that. Having that presented today. That's great news for all of our Highmark members here. So I'm gonna address an elephant in a room, and I do wanna, I don't wanna leave this one just outstanding. Someone is mentioning the cost for the non-65 plans and how they have gone up a little bit this year. And I do want to mention our non-65 retiree plans, those rates have not changed in about 2 to 3 years. Penn State is on that non-65 population. They're known as self-funded. And so it's our own claims experience. It's how often our retirees are using the plan, how often our retirees are using certain services. And then when we go to Highmark or when we go to Aetna, you know, they would say, okay, like, you know, these are the types of services that are being used. And, you know, we did receive an increase this year, and part of that increase that Penn State is paying, we absorbed most of it, but we did pass some of that off onto the retirees in the non-65 plans. So again, I did want to answer that one and kind of step up and answer that one face to face. I am not sure if this one is referring to a non-65 Highmark retiree or a Freedom Blue retiree, but the question is, when we used to have Highmark, we had to pay doctor bills and then send them to the processor. Will we be required to do this again? I think, and maybe Tyler and Steph can help me out with this, I think that sounds like you might have been using an out-of-network provider, and that means that they weren't doing any billing directly with the insurance company. So they were asking you to pay for something out of pocket and then, you know, submit for your own reimbursement through the insurance company. How about it, Tyler and Steph? Does that sound like maybe that might have been what was happening?
Yeah, I mean, it could have been that. It could have been maybe they didn't have the appropriate, you always want to make sure your providers have insurance. If they're just giving you a bill and not submitting to the insurance at all, it might be able to be remedied by providing the insurance information. But yes, if I had to guess, I would say probably maybe an out-of-network provider that wasn't willing to submit.
Okay, and I see Steph shaking her head too. So
Yeah, I think I agree with that. I sometimes see chiropractors be out of network. I see a lot of chiropractors not wanting to work with insurance companies. I'm not saying all of them are, but just be careful. Always get in the habit of asking if they participate in the Blues network. It is quite a large network. 95% of hospitals countrywide, 96%. Actually, I think I have that backwards, but 95 and 96 of hospital and providers in the whole country participate. So, I mean, your chances of running into a non-participating are slim to none, but it's always good to get in the habit of double checking if you're walking into a new facility.
Yeah, and also, sorry, not to drown on this, but
absolutely.
if you are receiving a bill, I would definitely recommend that you do not make payment on the bill until you get in touch with Highmark first to make sure that you're being billed appropriately for what you owe, especially if there was no claim submitted.
I think that's a great point, Tyler. Thank you. And that, again, that's almost insurance 101, whether you're over 65 or under 65. If you get a bill and you're like, this doesn't make any sense whatsoever,
Please call us.
yes, please call. So a question, do we pay for worldwide emergency care and then get reimbursed? So I'm going to address this one because I actually have two different answers, standard answers that I give for both of our populations. In our non-65 plans, they are plans that have worldwide coverage. So there is and I learned this from Steph this year, there is a Blues Global network. All right, help me out. What was the name of it?
It's called Blue Cross Blue Shield Global Core.
Perfect.
So, yep, Blue Cross Blue Shield Global Core.
However, there are many times when you are traveling out of country that you may have to pay for something out of pocket. If it's, that emergency care. And then when you come back to the US, you would submit a claim for reimbursement. You would go through that conversion rate. And so that's kind of the standard response we give for non-65 retirees. For our Medicare retirees, the answer to that is you do have coverage out of the country for up to 6 months. If you are out of the country longer than 6 months, there is a cancellation because basically what's happening is Medicare is not recognized outside the United States. So if you're going to be traveling out of the country for longer than 6 months, we recommend that you get in touch with Penn State Employee Benefits so that we can give you your options for insurance while you're traveling out of the country. And then Tyler, you said you were going to look for that nurses on call phone number. So I'm going to kind of leave that one with you. I'm going to jump down to the next one. If we live in
I
state.
do have it.
Never mind. Then let's go.
Yeah, a little bird gave it to me while I was carrying on in my presentation. So the Blues on Call number is, and hopefully whoever needs it is ready to take it down. 1-888-258-3428.
Okay, perfect.
I was able to type it into that answer. I'll send it.
Thank
Okay.
you.
If we live in State College and we receive care in Philadelphia, Harrisburg, or elsewhere due to care facilities, can someone access the PALS in our areas, even though that's not our primary residence? So, Tyler, are you familiar with how that might work if someone needs to travel from one town to another?
Yes, so I don't think that PALS is going to be, as far as using it, is going to be stipulated that you have to use it exactly where you reside. It's probably not the answer you're looking for, but for tricky situations like that, I would recommend that we get you in touch with them to kind of talk through the situation that you're going to be going through, or that you're looking for assistance on, because I don't want to guarantee assistance without getting kind of in touch with them. Like I said, it is a volunteer-based program as well, so it's going to be based on who's available to you at that time as well.
Can my spouse who is not yet in Medicare participate in Silver Sneakers as a guest? Gonna throw that one out to Tyler.
Can my spouse who's not yet enrolled in Medicare participate in Silver Sneakers as a guest?
I'm thinking no.
I don't think so. I don't think so, because they're not enrolled in the plan. I don't believe that would, this is part of your plan. And they are individual contracts. So I'm going to say no, I don't think so, unfortunately. But I know that some gyms do have their own guest policies. So you might be able to get, maybe a temporary pass or something like that.
So someone else was asking me about Silver Sneakers, if it was automatically available when they turned Medicare eligible. And I said Silver Sneakers is available through our Freedom Blue plan, which is the plan that we offer our Medicare eligible retirees. And the question is coming in. So like different Medicare Advantage plans may not have the Silver Sneakers product or option available to them. And I'm not able to answer that because I'm not familiar with Highmark's plans other than what our Penn State plan is.
Yeah, so a few different aspects of that question. You're going to be eligible for it from the time that you become effective in the Penn State Freedom Blue plan. And yeah, not all Medicare products are going to offer Silver Sneakers. So once you become effective in the Freedom Blue plan with Penn State, you would be automatically eligible at that time for Silver Sneakers.
Okay, so I have a question here, and I know that on our non-65 plans, absolutely, we say all emergency and urgent care is treated like an in-network claim, regardless of where you are. But for those of us that are over 65, the question is coming in, is urgent and emergency care covered if the provider is not in the Medicare network? And I'm gonna let my Tyler, my
I don't know that you
expert.
would be taken to an emergency facility that is not participating with Medicare. I think that there are certain qualifications that need to be met for certain facilities to be considered emergency facilities. So that's a great question. I can kind of look into that more, a little bit more deeply, but urgent care facilities and emergency rooms, I don't believe you'd probably be hard pressed to find one that is not Medicare participating.
So I'm gonna go ahead and ask the two members, I believe their husband and wife that are sitting there with us today. If you guys could maybe type in your phone number, I'm gonna let, or contact information, email address. I'm gonna let Tyler look into that a little bit more so that he's able to get back to you. Question, is John Hopkins in network? Once again, Steph, I know for our non-65 retirees, absolutely the answer is yes. Tyler, I'm fairly certain that the answer is yes for our Medicare Advantage plan as well. But if you could address
I do believe so as well. I can double check that and get back in touch with you, but I do believe so as well.
Okay.
Yeah, and I may add, John Hopkins is a Blue Distinction facility. If you ever are searching for providers and you see Blue Distinction attached to that, that is the highest quality and, less waste and just best service. So yeah, if you ever look for Blue Distinction, that's a good sign that you're walking into a good facility.
Thank you, Steph.
Mm-hmm.
All right, so for an annual exam, do you still need to pay the copay? Now with our non-65 plans, preventive care is covered at 100%. So if you're going in for a routine annual physical, you're going in for your annual mammogram, those are covered with no copay or no deductible. Medicare Advantage plan, Tyler's same federal law apply. Preventive care is covered at 100% with no copay.
Right. Yes. Preventative care is covered in full.
Yep. All right. Great question for this next one. And I am definitely throwing this one over to Tyler. Is there a maximum age for colonoscopies and annual female exams? So I know, kind of, again, I'm a little bit more familiar with our preventive schedules when it comes from the two-month well baby visits, your 6-month well baby visits up until age 40. Okay, actually, I'm gonna be honest, up until age 45, I'm familiar with those. But what do those look like after you get to 65, 70, 72?
I have never heard of any maximum ages being placed on colonoscopies or annual female exams.
Thank you. Another really great question. And so it is asking, so the Penn State Freedom Blue premium is $80 a month. But in order to be in a Medicare Advantage plan, I know Tyler kind of touched on some of this, Medicare does dictate that you must be enrolled in Medicare A and B. And so that Medicare Part B premium for the upcoming calendar year of 2023, I believe it's $164.90, $164.90. So yes, you are paying our $80 a month for Freedom Blue, but then you're also going to be paying to Social Security directly. That $80 a month is going to go to Lifetime Benefit Solutions. But then the $164.90 will go directly to Social Security. I want to do another quick time check with Clif. Clif, I don't know if you guys have other business to address today. Are you
just about to jump in and suggest it's getting towards 3:30 that
okay.
We certainly want to cut off at 3:30, so that'd be another 5 minutes.
Okay, so and again, there were some numbers that we posted. I want to reiterate this: the Highmark Concierge, Highmark Wealth 360 Concierge, that is for our non-65 retirees. That number is available right now. And then we have the Highmark Freedom Blue phone number. So any questions that are not being answered today, please make sure that you reach out to Highmark or our HR services team so that we can get your questions answered. Is mail order Express Scripts for this plan as well? So Express Scripts is Highmark's prescription vendor. So that's on our non-65 plans and our Medicare Advantage Freedom Blue plan. Tyler and Stephanie, is helicopter travel in an emergency considered to be ambulance?
These are some good questions today.
And again, please keep in mind, we are here to have this broad overview knowledge. We're typically good with people. We like to chat. We like to talk. So, some of these questions even stump us. And so some of your best resources, right, Tyler and Steph, are to call the numbers on the back of your card. Those individuals at the call center are able to specifically look up like our plan documents and answer those questions directly.
I don't believe that air ambulance is covered under a different benefit because it's so rare. It is something that's utilized when medically necessary, but it's not something that you see very commonly. I hope whoever posed that question doesn't need any air ambulances, but very good question.
Yeah, I think that's the key word, medically necessary, and most of the time that would fall in that category, but I do agree. Maybe we can look into that one further, just to make sure, because it's such a specific question.
I do have two other questions that came in, and then as I mentioned, we're gonna go ahead and cut the question and answer session. We're gonna bring that to an end. This has come up in the past about university health services not being able to send prescriptions out of state. Is that still the policy? Yes, that is still the policy. There is something about being able to mail prescriptions across state lines. And so if you are living out of state, then using the mail order express scripts through Highmark is going to be your better option doing mail order. Once again, the question was asked, will these slides be made available? Will a copy of this presentation be made available? Brian is recording this session. He is going to be letting you know how to link up to this presentation. He is going to let us know where it's posted. And so, yes, there will be continued access to this presentation. And Cliff, with that, would you like us to, say our goodbyes and let you wrap up your Retiree Association business?
Well, I would like to thank you for Kelly and Tyler for a terrific presentation and answering all these questions for us. And I'm sure if we were in person, everybody would be giving you a big hand for your presentation.
Oh, thank you guys so much.
Thank you.
Steph, thank you for joining us as well today. I appreciate your assistance on the non-65 side.
Of course. And I did a quick search of the air. It's called air ambulance. And I think that there is some sort of benefit, but it depends how it's coded. So that's kind of like the short answer. But thank you so much for having me.
Thank you.
Yes, thanks for having us. And we'll see you next year, I guess.
We'll see you next year.
Yes, thank you.
All right. So it's okay for us to log off. Are we good?
Yes, yeah.
Okay, perfect. All right. Goodbye, everyone. Have a great day.
Okay.
Bye.
Thank every attendees for coming to this very knowledgeable presentation. I would remind everybody that the next meeting is January 19th, where Jackie Esposito is going to give us a talk on from petticoats to PhDs, Penn State's women history. I hope everybody will have a pleasant afternoon, and so long for now.